Hello friends, welcome back to a video of anatomy physiology. We are studying about the respiratory system and we have completed some of the point like function of the respiratory system, organs of respiratory system, upper respiratory system tract, the nose, anatomy of nasal cavity, anatomy of nasal cavity part 2. In this we have understand about the bone and palate part, then your peripheral sinus, then function of parasneal sinus. Then now we will today going to study and know about the pharynx, that means your thorax. I hope you are understanding my video and the contents is useful for you. Let's start today the lecture of respiratory system in the part of anatomy and physiology class. First of all, we have to understand what is pharynx. Pharynx are the passage of a nasal cavity of a larynx. Three reasons of pharynx we have here. What are the three reasons? Let's start. The first reason is nasopharynx, that is the superior region behind a nasal cavity. Second one is oropharynx, that is the middle region behind mouth. Then third one is laryngopharynx, inferior region attached to a larynx. Now with the help of this diagram we will going to understand what are the parts of these cavities. Here you are understanding nasopharynx, oropharynx and laryngopharynx. This is your nasal pharynx. Here you can see the palate area of the nasal cavity, as well as the same part of this attached with the palate area. That means the interior nasal part is attached with the nasopharynx. This is the articulation part. Next is your oropharynx, which is attached to the epiglottis area. Here you can see this is the epiglottis part. This is attached with the oropharynx. Now coming to the laryngopharynx, here you can see the larynx and the oesophagus part, which is located just, oesophagus is just located behind your laryngopharynx, and larynx are articulated and attached with your laryngopharynx. Larynx, it is a basically part of a larynx only, laryngopharynx. Now coming back to the theoretical part. The oesopharynx and the laryngopharynx are common passageway of air and food. Now with the help of diagram again we will understand how the food passage and the air passage are same here. Here you can see the oesophagus, this is your oesophagus and this is your larynx. It is a common pathway over here when you are going to take the air from the mouth or you are taking the air from the nose. This area is work as a common. That's why when we eat something and suddenly we breathe at the same time, our food particles enters in the which part? Now I am telling about that why we get the food stroke sometimes when we used to eat and take the breathe in between the same period while we are swelling. Swelling means when we are taking food inside our digestive system. What happens at that time? Suddenly your palate over here gets open due to the respiration process, and same time when you are swallowing the food, some particle enters to your part of oesophagus, that is your respiratory tract. And the same in the same way, when the particles enters to that your respiratory tract, it push out through the air and we feel like something had stuck in our throat. Yeah. Here is the diagram as the same part. Now again we will understand the upper respiratory tract over here. We will revise the respiratory tract. Now coming to the naming of the respiratory tract. This is your frontal sinus, then this is your cerebrum from palate of ethmoid bone. This is your, here is your ethmoid bone. Now here is a superior notch, that is your medial notch. This is your inferior notch. This is your exterior nasal part. Yes, the tip of the nose. Hard palate. What hard palate basically do? It's separate. It divides your mouth and your nasal part. Okay. Then a soft palate, the skin over the skin just behind the hard palate. Okay. Now coming to the next part is your tongue. Next is your lingual tonsil. This is your lingual tonsil. Now epiglottis. This is your epiglottis. Then hyoid bone. What's the main activity of hyoid bone? It's help in the vocal process. Now thyroid cartilage of larynx. This is the cartilage of thyroid. What do you understand with the term thyroid? Thyroid is the it's a hormonal gland which secretes thyroid, that is T3, T4, TSH, FT3 and FT4. Then coronal cartilage of larynx, then thyroid gland and trachea. Now coming to the next part, this is your synovial sinus. This is the part of synovial sinus. What happens when it get swelled, inflamed? The respiratory tract, this area get reduced, and while this area get reduced, what happened? We feel breathlessness. Now coming to the next part, this is your pharyngeal tonsil. This is your opening of auditory tube. What is auditory tube? The vocal tube. Okay. This is your nasopharynx area. This is your internal nasal area. This particular part. This is the internal nasal area. This is your uvula. This part is your uvula. Just you can say just above your palatine tonsil. Okay. This is your oropharynx area. This is your laryngopharynx area. Just behind your hyoid bone. This is the hyoid bone, and just behind this laryngopharynx area. This is your vocal fluid. Vocal fluid means we used to say the bansuri. The term bansuri, where when we blow the air, they produce the sounds according to the openings of that fluid. So same as this work for vocal fluid. It's a type of a pipe which when the air is released from our lungs, it produces a different type of sound waves. Now this is your oesophagus. I hope the diagram is clear to you all. Coming to the next structure of pharynx. Now coming to the structure of pharynx, auditory tube enters the nasopharynx area. Tonsils of the tonsil of the pharynx. Now tonsil of the pharynx are of three part: paranasal tonsil, palatine tonsil, lingual tonsil. What these part work? First of all, we have to understand with the help of diagram. The place of your paranasal tonsil is just behind your ear. Okay, yeah, correct. We used to say plum, near your plum. Palatine tonsil is just last part of your mouth, when you used to open your mouth and see that the tongue ends there, just behind that. Lingual tonsil is just below the tongue area, starting of the tongue from our neck. Now we are studying about the structure of pharynx here. So I hope you have understand about the structure of pharynx. Now coming to the part of your structure of next part, which is your larynx, also known as a voice box. What basically larynx do? It's now coming to the larynx part, that is also known as your voice box. Now it's provide the routes of air and food into the proper channels. What are the channels over here? The food pipe as well as your respiratory tract. It's provide the separation first. Next is the play a role in speech how we are speaking, saying something, that means I am telling you about the larynx, how it's happening. Just because of the activity of your larynx, I am able to speak. Now next, made of 8 right rigid hyaline cartilage and spoon shaped flap of elastic cartilage. What is the basic here? When we are going through the different connective tissue and the cartilage, we have understand there is a two type of cartilage. One is of your elastic, known as yellow, and second is of your white, which is known as hard. So here is the soft spoon shape. What spoon shape basically do? It roots the what air and food channels. Okay. Now coming to the understanding with the help of diagram first. Let us understand about the larynx part, how it's work, and what are the proper roots of the working of this. Now coming to the part of anatomy of larynx, here we will understand what are the positions and what are the areas where your larynx are located. Here you can see with the help of diagram, this is your vertebrae columns of your, this is your vertebrae column of your cervical bones. Now coming to the part, this is your nasopharynx area. Again we are understanding, this is the nasopharynx area, this is your oryngopharynx area, this is your tongue. Now this is your epiglottis. Now what the epiglottis basically do? Epiglottis have the important role while the respiration and while when you swallowed something. When you swallowed something, what happens? It close the path of the food pipe and activate the part of your respiratory tract. When you breathe, then it close the respiratory your digestive tract and opens the respiratory tract. Epiglottis is the main part for that. This is your vocal cord. Here you can see the V-like structure, V-like structure. This basically do the blow of air according to the sound waves where we want to speak something. Like if I want to speak a, this what this muscles do, this build itself like that structure. When the sound wave moves from this vocal cord area, this produce a certain specific waves of the sound, which we are able to hear about the different words and the frictions. Now coming to the part of again larynx, this is your trachea and this is your epiglottis. This is your epiglottis and this is your trachea. Epiglottis is the, this part is your epiglottis and this is your trachea. Sorry, mistaken. This is your oesophagus and this is your trachea. Trachea is your respiratory tract and oesophagus is your food tract, yani digestive tract. Okay. Now coming to the part of your laryngoscopic view, how the laryngopharynx, this is the proper laryngoscopic view. Here you can see the tongue area, epiglottis area, vocal cord area. This is your vocal cord area. This is your trachea. Inside you can see the ring bands on the area. This is your oesophagus. This outer part is your oesophagus. Basically what this lip epiglottis works like, this muscles move toward this to open the oesophagus and move again this side to open the trachea. I hope you have understand the anatomy of larynx over here. Now coming to the part of next. Now coming to the theoretical part of structure of larynx. Here the thyroid cartilage we have seen over there, largest hyaline cartilage over here. Then the protracted anterior, that is your Adam's apple. Now Now coming to the next part, then we have seen the epiglottis area, then a superior opening of the larynx and root food of larynx and the air toward the trachea. Now coming to the diagram part, here we will going to try to understand what are the structure of larynx again. The part is the anatomy of larynx over here, divided into three categories: arterial view of intract larynx, postal view of intract larynx, and sagittal structure through the larynx. This is your anterior, this is your posterior, and this is your sagittal view. What is the anterior view over we can see is, this is your epiglottis part, this is your hyoid, this is your epiglottis, this is your hyoid, this is your thyroid ligament, this is your laryngeal promachnis, this is your thyroid cartilage, this is the complete part of your larynx, this is the complete part of your trachea. Now coming to the next part, this is your circular thyroid ligaments, that these are the ligaments. What are the ligaments do? Basically help in the attachments. Now coming to the next part, here is your posterior view. Again you can see the epiglottis fully area. This is called as the apple view of Adams. This is the apple view of the Adams. This is your sagittal view. Here you can see the epiglottis part, how it's look like. Rest are the same. Here you can see the ventricle fluid. Here is the vocal fluid. Here is your atheroid cartilage. Now this is your vocal fluid part, where the sound waves produce. This is your antheroid cartilage, this two part just behind your vocal fluid. Now coming to the sagittal view, here you can see the epiglottis part, thyroid membrane part, hyoid bone part. Now your superior horn of thyroid cartilage, this is the horn. Horn means the upper part of the cartilage. This is your tracheal cartilage. This is your circulatory thyroid ligament. This is the ligament part. Here is your again vocal fluid. Here is your ventricle fluid. This is your antheroid cartilage, and this is your sagittal cartilage. Okay, this is your ventricle fold. This is your vocal fold. Now this is your circulatory headal ligaments. So the whole part, I think you have understand the anatomy of ligament in three directional view. Now coming to the part of structure of larynx, also known as a vocal cord or a vocal floats, vibrate the expanded air to create a sound speech. How it's do? It's vibrate the air, making to the wavelength of the sound, which convert the wavelength of sound. Glottis opening between the vocal cord, how it's open and how it's closed. Let's understand with the help of the diagram. This is your structure of vocal fluid in a closed position, closed glottis, and this is your open position, open glottis diagram. Now coming to the part, this is your base of the tongue. The base of the tongue is interior part of the tongue. Okay. Now this is the epiglottis. This muscle here you are seeing is the epiglottis. We are talking about the closed glots, when the glots are closed. Okay. Now coming next is the your vestibular fluid. This is your vestibular fluid. Here it's open and create the vibration part also. Now coming to the vocal fluid, this is your vocal fluid tube, white colored you are seeing over here. True vocal fluid, we also can known as called it as a true vocal fluid. This is your glottis part, the middle part of this area. This is your glottis part. Now coming to the edgings of other, this is your conical phloem cartilage and cuniculate cartilage. This is your cuniculate cartilage and this is your cuneiform cartilage. The same is over here, but it's the opening glottis. How we understand the opening glottis over here? Now let's understand the vocal fluid of the opening position, that is open glottis. This is the open glottis area. You can see the internal trachea pipe over here. This is your trachea, and this is the same your base of the tongue, your epiglottis. This is your vestibular fluid, that is also known as false vocal cord. This is your here, this is the white part is your vocal fluid, also known as true vocal cord. This is your glottis area, opened in the opened way, open glottis, and this is your cuneiform cartilage. This is your chroniculate cartilage. I hope you have understand the vocal fluid area in the closed as well as in the open format. Now coming to the next part, this is your now coming to the next part of your respiratory system, that is also known as a trachea, and other name of trachea is the windpipe. What basically trachea do? Now we will understand the anatomy of a trachea, also known as a windpipe. Here you can see the larynx part. This is your trachea part. What is this? This is your trachea cartilage. This is your location of bronchus. Here you can see the primary bronchi and the secondary bronchi. This is the dividation of your trachea into two different part of the lungs. This is your root of the left lungs, and this is the root of the this is the right lung part, and this is the left lung part. This is the lung tracts. Now we will understand in the next part of where the further about the air sac, that is also known as alveoli. Now trachea, the windpipe, consists larynx with bronchi. What are the larynx? Larynx are this part is your larynx part, and this part is your bronchi part. In between the trachea is located. Lids with the silated mucosa. What are the silated mucosa? These part are of silated mucosas area. Okay. Breathe continuously in the operation direction and incoming air. What is the breathing? It is a process where you taking the air pathway in and out. What basically trachea do? It's a beat. Beat means rhythm. Tap 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 like this continuously for the opposite direction. Why it's work as the opposite direction? Because to take the air inside your lungs to transfer it from the bronchi. Expel muscles located with ducts and other debris allows from lungs. What basically it's do? It's explain the muscle means extracts the muscles to give the paths of the different direction or distribution in the properly bronchi area. Here the walls are focused with C shape. Now here you can see the ring shape structure. What's the ring shape structure basically do? Hyaline cartilage. This helps in the movement of the air through the lungs and outside from the lungs. This is the way how the tracheotomy activity performs in the hospital when something is stuck in your larynx area. The doctor makes a cut over here and insert that a tube by which the person is able to breathe. You can say it like a ventilator system. It's a proper ventilating system. Here you insert the tube for the food. Now coming to the bronchi part. What bronchi do? Basically it divide the trachea into two separate where the alveoli are placed inside the lungs for the filtration of oxygen. What are the primary bronchi structure? Here with the help of diagram first we will understand. Now this is the structure of your complete respiratory tract. Here you can see the trachea part, a ring-like structure. Here is the bronchus part, and inside the lungs here is your bronchis part. You are able to see it's look like a tree branches of small branches which are connected to the air sac. Also we can compare with the leaves in the tree system. This is the superior lobe of right lung. This is the superior. This is the medial lobe of right lung, and this is the inferior lobe of right lung. There are 3 lobes in the right lung and 2 lobes in the left lung. This is your secondary lobe, and this is your inferior lobe. Okay, this is the right main primary bronchus. This is the right main primary bronchus, and this is the left main primary bronchus. Okay, now coming to the lobes part, this is the secondary lobe part, and this is a segmental lobe part. Now what you are seeing over here, that one bronchi is divided into different branches of bronchi. Okay, bronchus is divided into different branch of bronchi. There is the bronchus, it's also named as bronchus. This small part are known as bronchi. Okay, in the end of the bronchi you will see the air sac known as alveoli. Primary bronchi formed by dividing the trachea enter the lungs at the ileus. Ileus is this part known as ileus. Now right bronchi is wider, stronger and straightened than left. The right bronchi are more than the left part. Why? Because the heart is located in your left side of the lungs. Bronchi subdivided into small and smaller bronchus. I am repeating the right main primary bronchus. Actually the diagram is a little bit wrong over here. The right one is here and the left one is here. This means the right main primary bronchus is this, and the left main primary bronchus is this. The last slide for today in our respiratory system, the lungs. The lungs occupy the thoracic cavity. Apex is near the clavicle, that is your superior protension portion. Base rests on the diaphragm, inferior portion. Each lung is divided into lobes by fissures. Left lung 2 lobes and right lung 3 lobes. With the help of diagram we will able to understand the complete lungs structure. In the previous part I tell you about the alveoli. Okay, we are going through the diagram of lungs. Let's complete the lecture for today. This is your trachea part, also known as a windpipe. This is your right lobe and this is your left lobe. This is the right lobe divided into 3 categories. First, second and third. This is your right bronchi and this is your left bronchi. This is the further is divided into secondary bronchi. This is the secondary bronchi, and this is the small part you are seeing over here is the bronchus, and this is your palliaris. This is your pleura. Okay. Now coming to the left lobe. This is your left bronchi. This is your alveoli, also known as air sac, and this is your diaphragm. That's all for today. I hope you have understand the respiratory system. Till now we have completed the pharynx part, your structure of pharynx, your larynx, also known as a voice box, your structure of larynx, then trachea, then tracheotomy, then primary bronchi, then last is the lungs. Now we will continue with the structure of your lungs in the next class. Thank you. Keep studying.